Hey, wanted to clarify some information, do a little training since we all can't meet together in large groups. First, we want to talk about stocking on the ambulance. So each ambulance should have 4 N95 masks. Each engine and truck, the engine and truck each should have 4 N95 masks. You might see a couple different ones. These are the ones that we have currently in limited stock. These are the ones we have in back stock to replace the blue ones. So you might see either one of them. You shouldn't have any of the gray ones with the filter in the middle of them. Those are for wildland. Surgical masks are for the patients. We have a few of these left, so utilize what we have left for patients with these, and then we'll go to the N95s for them as well. The goggles are primary eye protection. They can be clean. They should not be thrown away. Clean with warm soap, warm soapy water. You can also use regular safety glasses as well, but they have to meet CDC criteria and come all the way across your eye. So when you put them on, they should go all the way past your eye and cover the end of the eye. The face masks, these are disposable. You should only really need these if you're doing anything that has a splash or blood splatter, intubation. If you don't have the goggles, if you only have these and you're going to intubate, you need to have the face mask on. And then gloves, of course. Hey, I want to talk to you about a new kit we're going to have on the ambulance. This is going to help reduce the potential exposure to our EMS bags and our monitor. In this kit, you have stethoscope, large blood pressure cuff, extra large blood pressure cuff, and a thermometer set. You'll either have a surgical mask or N95, depending on our stock limits. These are for the patient. Obviously, you would be have your N95 on before you make entry to the house, along with your gloves and your eye protection. This gives you your first set of vitals and your screening criteria. So if a patient screens positive, you could radio back out to your crew, have them, if you need more supplies, have them bring it in or leave it by the front door. We're trying to limit the amount of personnel in contact, and we're trying to limit the exposure to our equipment. So when your patient screens positive, this will be the kit you bring in. Or if you ask them on your initial assessment, this will be your initial kit. And then if you need more supplies or other resources, radio back out to your engine crew to have it waiting for you, whatever you need. So stocking wise, each ambulance should have, again, 4 N95 masks. The surgical masks for the patients, 10, or if we run out, we'll have to have more N95 masks for them. 2 goggles on the ambulance. And then each individual person should have their own safety glasses, but make sure that they cover the outside of the eye protection. And then 2 face masks on every ambulance. As well as, so right now we have a limited supply of gowns on the ambulance, so we're gonna have to modify Tyvek suits. So we'll have 5 gowns or 5 Tyvek suits, either one. And we're gonna show you how to modify the Tyvek suits. I'm gonna show y'all how we cut the Tyvek suits to make the gown. So that anytime you use the gown, it should only be for any aerosol generating procedures, so nebulizer, non-rebreather, CPAP, BiPAP, intubation, CPR using a BVM. So what we did first, we came across and we cut right across the top of the legs. So you should have individual leg pieces. You take those, you're done. You're gonna come around here, you're gonna cut around the bottom seam of the hood and then up the zipper line on the seam of the zipper, all the way around the back. Take your top piece and you're just gonna cut right up the middle of the top and then leave you about 3 to 4 inches at the top of the neckline. So when you put it on, put it on just like a gown. And this is a large. We have large and extra large, so if you're a bigger guy, you need to make sure you get the extra large. And that's how it'll fit. So, all right, so we're gonna demonstrate after a transport. You get to the hospital, you need to doff your gown and your PPE. Obviously, I would have my mask on, but making this video, I won't be able to hear me. So I would have my mask on. First thing I do, I wanna grab around the shoulders and break the collar on the way down. And I don't want to touch my skin with any of the outside of the gown or my gloves. So my gloves are going to go to the inside. And once I have everything in the inside, I'll pull one glove off. Take underneath my finger on this side and pull this glove off from the inside. All this would go into a biohazard bag. I would remove my mask in the trash with the stuff, and then clean my hands really good. If you have any questions, please holler. Be safe.